lack of information on the COVID-19 spread, a ferry named Romance heading to Germany to rescue stranded Estonians, and life getting quieter on the streets. State of emergency, day 5, Tallinn, Estonia. It's the 17th of March 2020. So we started the day with the new numbers from the health board. Seemingly, actually not that bad. 20 new cases, total of 225. So yes, the question is testing, because the health board themselves, they admit that so far the so-called average person infected is a middle-aged person, and there's no difference between men and women as far as the spread of the disease goes. By now, as far as we know, they're not testing middle-aged people anymore, they're only testing risk groups. So that brings forth the question how many middle-aged people are out there who are actually carrying the disease and don't know it. For example, one of my colleagues is still awaiting the result of the test, and he did it on Thursday. By now it's Tuesday. We have no information about any more people being hospitalized. The health board in the same briefing in the morning announced that most of the people have milder symptoms. However, there are no numbers, it's just this claim that most, and well, I mean, if there are no more people hospitalized, that's great news. And let's hope that it stays like that way for a long time. But their communication is lacking, and you can see that it started to create some backlash. Because we are living in a democracy, and people want to know what's going on so they can make informed decisions and be aware of the situation. Also, one of the key points why we need information is to combat mis or even disinformation. And battling misinformation is absolutely necessary to ensure that people don't start panicking. So I actually took a glance myself to the North Estonia Medical Center. It's actually quite near to my home, and it was fairly quiet there, I have to say. I mean, all visits are banned, and there are some volunteers from the Voluntary Defense League there waiting, helping, but yeah, that's not the army. The army is not sealing off Tallinn like some people have been claiming, and the army is not taking control of the hospitals, etc. These peoples in these uniforms in this instance are volunteers. And the tent outside the hospital is to ensure that people who come to the emergency aid department, that they're not carrying the disease. So people who turn to the emergency aid department in the hospital, they will be assessed whether there's a chance they're carrying the COVID disease and whether their health is actually at risk with whatever problem they're turning towards the emergency aid. So about information and misinformation, there are actually scientists and experts who would be glad to help with the current crisis logistically and actually mapping the spread of the disease, how to seal it, how to predict the future course of the disease, how much has it affected different regions, different age groups, and so on. But for that we need more testing, we need broader data, and that's what we're lacking because we're not testing broadly at the moment. We all understand the challenges that the health board is facing as well as the government. I can't imagine the difficulty of their work these days, and my respect to all of them. But yeah, we also have to understand that people want to know what's going on. So for example, the question of data, they're working on how to systematically organize it and also how to solve questions regarding data protection. It does seem that the health board is listening as well as the government, and they're trying to improve. So they admit the need for broader testing, and they're going to widen the group of people tested, including people with milder symptoms, not only elderly people and people with pre-existing conditions. So you need a letter from your GP, and the GP will assess whether you might be carrying COVID-19, and then you will be assigned a test or not. So we know that still a couple of days ago their testing capabilities were around 120, but now it's around 250, and they're improving constantly. So let's see what the numbers are going to be in a few days. All in all, this should bring in a lot more data, and we should have a lot clearer picture of what's actually going on. So, for example, thanks to the initiative of Garage 48 and Accelerate Estonia, they organized a hackathon and now have a proper webpage, coronacard.ee. So now we have a good online source with a proper overview and visualized data. It was even picked up by Forbes, so cheers. A big announcement from today is that the government will compensate the people whose jobs will be affected by the current outbreak. This means that up to 70% of their income will be covered. All in all, the details are still vague, but they're working on the specifics and it should apply for the next 2 or 3 months. This is one of the major steps of the government's economical support plans. A special ferry connection has been organized for the people who were stranded on the German-Polish border yesterday. So since the passage through Poland has been shut, they're looking for a way to cross the Baltic. Tallink has organized a ferry named Romance to head to Sassnitz in Germany to pick up the people from there, bring them to Riga, where they can drive back home, hopefully. The ship departs from Germany tomorrow, 11:55 p.m. The trip should take around 24 hours, so the people should arrive to Riga on Thursday before midnight. So I can imagine the captain in the cockpit of Romance sailing through the midnight waves right now and heading to save the stranded Estonians. Reportedly, a number of Estonians are already trying to get to Scandinavia by Denmark and cross the straits to Sweden, trying to get through Sweden to Finland and then take a ferry from Finland to Estonia. The problem here is that Finland will close their borders on Thursday, so everyone's racing against time. So Tallink is also decreasing the ferry connections between Helsinki and Tallinn. Currently, out of the 2 main ferries, Star and Megastar, only Megastar will continue the service, but for how long will be yet to see. I went downtown today. I hadn't been downtown, I think, since Thursday. My theater is located in the Old Town, and I just wanted to see what the city feels like at the moment. So places where you would normally expect a lot of rush hour noise were actually quite quiet. While at the moment there are no restrictions to the opening times of bars and restaurants, the selling of alcoholic beverages is now allowed only from 10 in the morning until 10 in the evening, which is the usual case in Estonian stores, for example. While the government hasn't imposed any closures, then a lot of cafes, bars had already closed on their own initiative. I dropped by one of the busiest shopping centers, well, usually the busiest shopping centers, which felt quite abandoned. Most of the stores were still open, including the bookstore that I dropped by to get something, but more or less I was the only customer, at least in the bookstore. But well, maybe everybody already got the books that they needed a few days ago, and now they're tucked in under the blankets on the sofas and taking it easy. So while this may feel like a perpetual state of limbo, let's just stay patient and let's let people do their jobs. So stay safe.